For construction workers, building a hospital or medical office building is special because it's a place where lives are started and saved every single day.
They're a driver of jobs, they're a driver of the economy, and they also provide the services that our families and members really need.
When State Building Trades Council President Robbie Hunter was an iron worker, he worked on more than a dozen hospitals, including the Loma Linda Medical Center, which specializes in cancer care.
It was an existing hospital. We were bringing in steel. As you're working around and you get in an elevator and there's a person in a wheelchair or a child being held by the hand, and you realize how important those places are.
That sense of achievement for working on an important project is one that all construction workers at hospitals share.
It gives me a sense of pride to have worked on a project such as this in this community, in my community.
It feels really good. I never thought that I'd be giving back to the community in this way.
Grew up over here. One of the things I always wanted to do was give back. So this project right here was like, I mean, I could die tomorrow and be a happy man because I've been able to give back to my community.
It's like miracles 24/7 that occur in a hospital.
Dwayne Donner served as president of the California Hospital Association since 1985.
I've been in thousands of hospitals over my career, and when I see a hospital and I'm in a hospital, I think about caring, dedicated people, and saving lives.
Hospitals welcome and care for all patients, regardless of their ethnicity, language, or ability to pay. When you or a loved one needs a hospital, you want it to be there 24 hours a day, 7 days a week. You want it to have the most state-of-the-art equipment and the most talented medical professionals. Building a hospital is complex. There are stringent standards to ensure that the hospital is always functioning.
Healthcare facilities are certainly some of the more challenging. There's a lot of unique spaces that are really geared towards the service that they're offering.
Hospitals and medical office buildings are different than other buildings in the construction industry because they have a higher standard for construction.
It's a real state-of-the-art facility. There's a lot of cutting-edge technology. That's exciting for me as a worker because I'm constantly having to keep my skills sharp. Everything comes down to worrying about the safety of the patient.
I have to get it right. And so I know that when a doctor operates or when a patient comes in, they got to plug in a machine. It's based on my electrical knowledge that we installed this per the plans and specs, that this is a quality installation and that it works, and it works like it's supposed to work.
California has more than 400 hospitals. This includes 300 plus emergency departments and 75 that provide trauma care. The California Hospital Association represents more than 97% of all the hospital beds.
Hospitals provide direct services to patients, emergency patients, outpatient, inpatient, and so forth. But they do many, many other things. They provide community benefits. Many hospitals have mobile units that go out and deliver services all the way from dental to screenings.
Hospitals also offer a wide range of educational programs, from healthy eating to tobacco cessation, exercise programs, and more. Hospitals benefit their communities in much broader ways as well. Research hospitals delve into clinical and community health issues, and teaching hospitals train the next generation of healthcare providers. Hospitals are often the largest employer in a community. They generate nearly 1 million jobs statewide. California leads the nation in healthcare real estate construction, in large part due to state regulations designed to keep hospitals working after an earthquake or other natural disaster.
The fact is, hospitals, because they're safety net institutions, and they have to be there, especially in disasters where the demand is really high, we want them to remain operational.
It's estimated that $140 billion will be spent to get every hospital building to reach compliance with seismic standards.
The seismic upgrades that they have done and the construction they have done, they really do not cut corners. They want it done once, they want it done right, they want it done by the least amount of workers, done in the least amount of time, under the lowest bid. And we meet their needs. And that's why the Hospital Association and the individual hospitals and the building trades are great partners.
hospitals and the building trades work together on policies that promote a healthy society.
The California Hospital Association Board of Trustees adopted a policy that in hospital construction, that the workers should have health coverage provided.
We work together here in Sacramento on supporting prevailing wage and making sure the construction workers can make a decent living. And we support them in their efforts to deliver care at the most affordable price.
We find that the building trades are essential to safe hospitals, and we appreciate the dedication of those individuals when they're working at a hospital site. Every building's important, but some are more important than others, and hospitals are certainly at the top of that list.
Working hand in hand, the building trades build the hospitals that benefit construction union members and their families and communities. And that's a healthy relationship.